Thank you once again and welcome back to this channel. So today I'm going to talk about how to optimize and actually customize your internship and attachment experience. And the reason as to why I'm having this conversation, I had a colleague and a friend who reached out this past week, and the conversation was, I'm yet to go for my attachments and the elective generally, and in this particular process I already have an interest in a particular line of practice, and I'm wondering how do I make it be more valuable and more impactful for me as a professional during this experience, but at the same time, how do I identify a location and a facility that is going to give me the best learning experience? We all understand the dynamics in the industry. There are places where there's a lot of work in terms of real pharmaceutical practice, but also we've known the aspect and the extent to which unethical and unprofessional practices are in the industry. So at this point, it means then as a professional going to learn as a young pharmacist, you need to find the best location where, one, you'll be working under qualified and actually competent professionals who are going to do their job and guide you in the process. You need to learn from the best. So that is one thing. Two, you need to be able to learn from a space where there are structures and there are systems and processes in place to enable you understand the dynamics within which you're working. So one, you get understanding on how the business or the company or the organization was working at a local level, but at the same time you gain additional experiential learning on how to set up system, how these systems work, and what are the different career spaces, because at the end of the day, past your training, you need to be able to be competent enough to practice in a particular line of choice that you will establish. So for these, the key question that is there, the first thing is, how do you give and get the attachment or internship placement be where you're going to customize that experience, where you optimize your learning outcomes, and at the end of the day become a better qualified professional? So the first thing is to explore what are your interest areas. In this particular case, the interest was clear. She has an inclination to industrial pharmacy, and therefore definitely she has to go to a pharmaceutical industry for her electives in this particular case. Luckily enough, in the subsequent phases for internship, when you go for internship in Kenya, it has been broadened up and opened up to integrate community pharmacy, hospital pharmacy, primary healthcare, and also industrial pharmacy. But at the elective where you have an option of only choosing one, then you need to be sure that this is an area that I have more interest in. But if not, then it's still okay. You choose one and actually make the best of it as you learn. And then once you learn and know whether you like it or not, you can change in the subsequent phases when you're going for your internship. So that is the most important bit. Then when you've identified an institution that you're going to, at this particular case, we talked about industrial pharmacy, but all the others are still going to apply. You've identified an institution, whether it's a community pharmacy, a hospital, an industry, or a primary healthcare center where you're going to do your electives or your attachment. The first thing that you do is you normally report to your preceptor. The preceptor is the pharmacist in charge of training at that particular institution, who will receive you into facility, induct you and orient you in terms of how the operations are, what you need to learn, how you get the best learning experience, and what would be the expectations in terms of your deliverables as an individual in that particular institution. So you need to have an understanding of all that. During that induction phase and orientation phase, you need to understand that maybe for an elective you have 2 months of practice. For the internship, some of the station you have up to 6 months. So you need to be able to figure out what are the best learning outcomes. And this is something that I feel, I recently did a course with McKinsey Forward program, and one key thing that was clear for me is we need to have learning intentions. Learning intentions is driven by what do I want to learn, what skill sets do I want to gain, and how do I intend to apply these skills post the learning, because that will help you know what you need to learn, how you need to get the learning, and even the preceptor is a better position to give you insights on how you get that experience in that facility. So the most critical thing is you've been there, you know how timelines you have. First phase, the first 2 weeks, assuming it's the 2-month rotation, talk to your preceptor. Tell them for the 2 months, that is 8 weeks averagely, you're going to take 2 weeks to walk around and rotate in all of the respective stations. The reason as to why you take two days in all the respective stations, let's say for example in industry, from production, warehousing, dispatch, sales, marketing, and all that, 2 days in each of them, to get high level understanding on which operations take place in these stations, which activities are happening, what is the essence of having a qualified, technically sound and technically competent pharmacist or pharmaceutical specialist in that particular department. Then once you've taken the first 2 weeks, you definitely are going to establish a particular focused interest. Assuming you have an interest, for example, in regulatory affairs, during that 2-week rotation across the industry, getting high level oversight, you already know who is the company pharmacist responsible for regulatory affairs, the regulatory affairs specialist. If you're working in a hospital setting, who is responsible for pediatric care? Who is responsible for oncology pharmacy? Who is the responsible infectious disease specialist or emergency or critical care pharmacist at that level? So you already have an understanding of who is the right person to train you in that area that you have an interest in. And then you come back after the 2 weeks to have this discussion with your preceptor, but at the same time, you've hinted it to the key person you're going to learn under and work with in that experience. So one, you've identified the location, you've had overarching understanding on what operations happen in that pharmaceutical setting, and it's informed by also the training, the deductive learning in terms of instructed learning in university lectures. Then now when you're already through the first 2 weeks, you have another meeting with your preceptor and the particular station, or it might even be 2 stations, but you want to learn more in depth and gain experience by actually doing the work that happens in that space. So once you've established that, have that conversation and offer yourself to be able to be served and to help, in the sense that if you're dealing in regulatory affairs, can you see what the dossiers are look like? Can you do the review? Can you prepare the administrative document, let's say for example in module 1 section? If you're able to help them in making that, can you do follow-up to the regulatory authorities to see how that process works from a regulator standpoint? Then what can you do to ensure that you streamline the process, getting the best quality documents submitted, after the submissions are of the right quality, following up to get approvals, and once approved, giving cross-functional teams information about the regulatory processes. By you being able to offer yourself that, I want to learn, but I'm learning by doing and learning by helping. So therefore it makes it easier for them to engage with you, to work with you, to make your experience more impactful and more valuable, but at the same time it's giving you an opportunity to work with others and to get value out of your internship. Because one of the critical bits that happen is you find you'll go through these stations because you are not clear on what you want to learn, how you want to learn, and you've not taken time to get an overview understanding of what the operations are so that you can target and pinpoint a particular area of learning. You get into the station and therefore you'll be moving from one station to another without clear outcomes that you're hoping for, without clear learning intentions. And therefore even engaging with your preceptor, engaging with the guiding pharmacist or the specialists in the departments that you're going through becomes an uphill task, because you don't know, why do I need to get this experience? How do I want to build myself and grow in this line? So when you get that kind of overarching understanding and you make it very customized and particular, you're better positioned to make your internship experience better. Then once that is in place and you've already established and you're working with this person for the 2 weeks, the best way for you to learn as a professional is actually to take notes on what are the key learning, what are the key principles that inform the practice in that line of work. Then once you're documenting it, have your key learnings, but also have examples on how you can apply that knowledge to improve the business processes. You're going to work in a hospital, you're going to work in a pharmacy, you're going to work in a primary healthcare center, or in a pharmaceutical industry. The more you learn, because you're coming from a different standpoint, in the sense that you're out from school, you have the idealistic approach to life, you have new ideas that you think can be implemented, and you're also learning from an ideal perspective from literature that is captured. Then in the industries or in the different facilities that you're going to be based, these practices are in the real world with challenges, with bottlenecks, and with constraints. So you need to understand the constraints, but you also need to see how can we make or actually overcome these challenges and these constraints to have an ideal system that ensures we deliver optimal value, streamline our processes, and get optimal successes. In so doing, you're gaining learning, you're supporting the company, and at the end of the day, you are developing recommendations on how they can improve their operations as a company, as an organization, or as a facility. By so doing, you are learning, and you're learning by getting value. And in that value, the company is in a better position to shape their course of action and shape their dynamics. At the end of the day, you can publish that in terms of your own research, your articles on LinkedIn and all that. The key is you develop a portfolio of your experience and your main learnings. Because the reason that's why I say this is because when you're done with school, when you're done with your internship, you're going to start looking for a job. When you're looking for a job, you need to have a portfolio of experience of what you've done, what accomplishments you've done. Definitely it comes like that. So if you're going to get a portfolio of your experiences, these elective experiences, attachments, internship is the best place to get valuable experience. And these valuable experiences in terms of, I learned this and this. These were the constraints and the challenges that I was getting through. These are my recommendations. And therefore, even if I'm going to recruit you as a professional into my company because you have an interest, let's say, for example, in pharmacovigilance, I already know, then you are working in a community pharmacy. You're able to point out adverse events that were coming from the patients. You're able to document these and recommend submission to the regulator, which means you're helping collect that evidence, the vigilance aspect. Then once you collected it and made that information available, what were your follow-ups? Are you helping the consulting with the patients and making patient follow-ups? Are you discussing with the pharmaceutical manufacturer to see how the medicine information on leaflets can be updated with this new emerging evidence to ensure that you learn more about it? And then at the local level, are you switching the medications? Are you consulting with the physicians, the doctors? So that we feel like there's that kind of desire to make a difference and doing changes. And if you document that and you're building a portfolio, one, you learn as an individual as you grow. Two, you build a portfolio of experience and accomplishment. Therefore, it makes it easier for you to present your case as an expert professional when you're looking for a job or when you're already employed and you want to grow in a particular line of work. And it also helps you craft a path that you want to pursue in your own professional and personal development journey. And if you're able to do that, then I believe you'll be at a better level to position yourself for the journey after internship, when you're now looking for a job or when you're starting your business, because you know how different use cases and different dynamics of the industry are working better. I hope this video is of help to you. If you enjoy the conversation, subscribe to the channel. Let's share the conversation, the insights with the other people, and let's make the profession grow better by learning and doing better in our different walks of life. Thank you so much, and let's meet again next Sunday.